yes, you are struggling and suffering postpartum, but there are tools, there are methods that can help you. Life can get easier. It does not have to be this hard all the time. So resources are definitely available, should you choose to pursue them.
Welcome back to the Midwifery Wisdom Podcast. This week, we get to hear from co-host Angela Love as she meets with Ruthie Eisenberg, a dedicated California-licensed psychotherapist currently located in Israel. Ruthie shares her personal story of what brought her to focus her career on maternal and perinatal mental health, including her own parenting journey. Together, Angela and Ruthie dive into a variety of topics surrounding maternal mental health, including normal and abnormal emotional reactions, cues of typical hormonal reactions versus postpartum depression or postpartum anxiety, the impact of sleep deprivation, trauma during birth and how that is registered in a mother's brain, perinatal mood checkers, intrusive thoughts, medication for perinatal mental health, and so much more. Ruthie also shares a personal passion she has in yoga nidra and shares how helpful she believes it is for postpartum mental health restoration. Without further ado, let's dive into this expansive episode.
Hello, beloved community. This is Angela Love coming to you today from sunny Florida. I am a nurse midwife with a home birth practice, and this year I've been a midwife 20 years. And I also have a telehealth business for midwives called Midwifery, trying to help midwife clients get medications that they need. I'm really excited about our topic today. We're going to be talking about perinatal health, and with me is Ruthie. And if Ruthie, you want to introduce yourself to our audience?
Thanks for having me on the show. Happy to be here. And my name is Ruthie Eisenberg. And let's see, who am I? That's a big question. I'll tell you a little bit what I do, but that's not who I am. It's just some of the roles that I play. So some of my roles are I'm a mom. I have 2 kids. I have a 9-year-old and a 6-year-old. And I work as a therapist. I have my own practice called Mental Fitness Therapy, where we specialize in seeing moms, dads, perinatal people, and also the general population as well. It's about half of my practice. And then the rest of the time, I dedicate a lot of time to yoga. So I'm a student of yoga. I'm also a teacher of yoga. I also have a podcast for yoga nidra for non-sleep deep rest practice, which I find to be just transformationally helpful. And during my free time, I like to spend as much time as possible outside in nature, doing creative things and quality time, family, friends, and also with my community.
Beautiful. And where you're coming to us, I think, from the other side of the world, Ruthie, where are you at currently?
So currently I'm in Israel, and this is a bit of interesting place to be these days because there is a war going on here. But I have to say, I feel so safe being here, and it's this experience really brings the point home to me that safety, it starts from the inside. It's a sense of how we feel, and sometimes when I zoom out and I start thinking about the situation, then I start feeling unsafe, like, oh, maybe I feel unsafe, let's say taking a bus to Jerusalem or something. But then when I get there, I feel completely safe. So safety is such an interesting subjective thing.
It really is.
Yeah.
Yeah. So I got interested in perinatal mental health as a midwife because I saw a lot of my clients struggling. Some of them would be struggling during pregnancy. Some of them would be struggling after. It's a humongous transformation, becoming a parent, and kind of like the old self dying off a little bit and a new self being created. Combine that with hormonal changes, combine that with sleep deprivation, and a lot of people have a really hard time. And so that's how I kind of like dip my toe into start looking into it. And I took the training through Postpartum Support International. I've taken their prescriber training, and I've also taken their pharmacology and all of their main trainings too. So
Cool.
now tell me about your journey to be interested in perinatal mental health.
Yeah. So I actually came into perinatal mental health kind of by accident. I didn't plan to end up with this specialization, but it just kind of happened, and really fortuitously. My story is that with my first kid, I had very mixed feelings about becoming a mom, and part of me really wanted that experience and really wanted to have a kid and have a child in my life and raise a child. And then part of me was just so terrified, and I thought I was going to lose all my freedom and just never have any fun anymore. So my first kid, that didn't come true. My expectations were so low that the reality was actually much better. And I had a good experience. However, with my second kid, I there were definitely some curveballs, and it was uh, he arrived early. I had to stop working like very abruptly. I went to the hospital for routine monitoring with my laptop planning to go back to the office. And they said, like, no, you can't really leave anymore. You have to have the baby today. I was like, what? I'm not ready for this. And things just didn't go as planned in many ways. It was also a difficult year that just different situational stressors kind of piled up and snowballed. And through all of this, I was managing. I was holding down a job. I was taking care of both of my kids. I was dealing with all the external situational stressors that came my way. And the stress definitely took a toll on me, which I didn't really realize at the time. But I had a hard time. I was constantly just stressed. I was anxious. I was irritated a lot. I was using coping skills to kind of power through it, but on the inside, I wasn't feeling great. So eventually things came to a head, and through just a series of really fortunate events, I ended up in a job as a clinician at perinatal IOP PHP program, intensive outpatient program at El Camino Hospital in Mountain View, in the moms program. And that was just the best place for me to be, because there I, first of all, got really excellent training in the perinatal specialty. I also had just the honor of working with some really incredible people there. We had this magical, fantastic team, and good things happened there, And it also really helped me to gain insight into what my own process was and what I was going through, and these little symptoms that I didn't even realize at the time that I was having. It kind of like brought all these things to light, that, oh wait, it's not okay to feel so anxious so much of the time, perinatal, postpartum. It's that having even having like intrusive or catastrophic thoughts about something bad happening to the baby, that, oh, that's a normal thing, that actually a lot of moms have that. So we had like a whole unit on using Brene Brown's curriculum. And so that was really shame deactivating. And that was just that was just very, very healing. I feel like I kind of vicariously, were benefited as vicariously kind of as a byproduct of being a therapist and learning about perinatal mental health and working with the patients there. And the material just kind of seeped in by osmosis and helped me as well. So after that, well, during that time, actually, I also did the PSI training. I did the components of care and advanced psychotherapy training, which was really good. So it's good to hear that you did a training with them also. And then I've just been seeing new parents and moms ever since. It became a passion of mine, and I plan to continue. So
Beautiful. There's a lot of work to be done.
Yes, there is.
Yes. And I feel like I try to talk to each one of my birthing families about the anticipated mood changes that are coming postpartum for a lot of people, so that they can be aware of what's possible, be on the lookout for these signs and symptoms, and develop a plan, in case we do need to take some actions. How are we going to work with this? So do you want to start talking about maybe the baby blues, the first things that show up?
Oh, yeah, sure. We can talk about the baby blues. Well, first of all, that's so awesome that I just want to comment how amazing it is that you prep your patients and you talk to them ahead of time about what could happen and what to expect, so that they don't get hit with an anvil with something that's, such a unfamiliar thing. As they say, knowledge is power. And unfortunately, a lot of moms that I've worked with have not been prepped and are just very surprised that they're feeling all these symptoms and that life is so difficult. They just get very surprised and really feel like, they've been hit by a bus after having a baby. So getting back to the baby blues, most people have baby blues. Baby blues it's a hormonal thing, and it's feeling tearful, feeling, just feeling kind of out of sorts, feeling sad. Um, and it happens in the first 2 to 3 weeks postpartum. However, if these symptoms are persisting after, I would say like after 2 to 3 weeks, if they're not getting better, not resolving, and either staying the same or getting worse, then we are looking at a postpartum depression, which needs to be addressed. I remember when I had baby blues, my husband like put a fork on the table and I started crying just from that. So we know that when the response is not proportional to the trigger, that's baby blues. It's hormonal. It's not really logical.
Yeah.
We can kind of laugh at it, but it is a real thing. So I want moms to be empowered and to know that it's normal to feel sad, and it's normal to be tearful and crying and get anxious and have some of these symptoms after.
Yeah. I think it's like this amazing, powerful, intense process has just happened, birth. And everything takes on like a hyper awareness and a hyper significance. And I remember when I was taking care of my sister postpartum and she was staying with me. So I had a very close look at a postpartum day in and day out. And it was like she only wanted to talk about really deep things. It was like she was on another plane of existence for a couple of weeks where just everything was really intense. And sometimes it would be elation and joy and amazement. And then a sad commercial would come on and, she'd be sobbing. So it was that moodiness, that up and that down. And yeah, just like you said, out of proportion to really what's going on. But it's an interesting place to be. And I think I didn't really enjoy the baby blues until it was happening with my sister, and I just had the time just to sit there and really talk to her about all the things,
Yeah, that's cool. When you're sharing that, it makes me think that birth is such a it's such a powerful experience, and it almost like puts you in a different state of consciousness in a way where, like, in a birth process, there's almost like this ego dissolution that happens, and defenses kind of have to be down. The normal defenses that work for us in ordinary life are not going to work in the labor and delivery room, where it's like, okay, anything goes. I have no control over my body. I don't have much control over anything right now. Um, so the emotional openness kind of comes along with that state, and it continues a little lingering into this postpartum, into the postpartum aftermath. And uh, yeah, and it's just it is a process, and it is a journey, and it's kind of like, you step into this doorway, through this doorway into parenthood. It opens a whole different world, and kind of start seeing things through different eyes, and um, that carries a lot of emotional weight and resonance. If somebody doesn't have deep deep emotions or baby blues in the beginning, some people don't have it, but it is more the norm than the exception. It is more of the norm than the exception.
Yeah, and I think the
Yeah.
PSI tells you the incidence is maybe around 80%.
85%. Yeah,
Yeah.
that's right. Yeah. I
Oh,
wonder, can I ask, what do you tell your patients or your clients about baby blues, and kind of how to cope with them or what to expect?
yeah, I just tell them to be on the lookout and that it's normal and to keep talking to their partners, keep
Mhm.
communication open, be supportive,
Mhm.
not get too anxious about the moodiness that usually it just goes away on its own,
Mhm.
because you kind of get used to the new hormonal shift,
Mhm.
and you may be developing a little bit of better sleep habits, you know?
Mhm. Yeah. Sleep is a big deal.
It is a very big deal. Yeah.
You have like one night without much sleep, then okay, the next morning you can kind of wing it and be okay. You have 2 nights like that, then you're a zombie. You have 3 nights like that, then all bets are on.
That's right, and I mean, they use sleep deprivation as a form of torture in the military, you
That's
know?
right. And it induces psychosis after not sleeping for about 72 hours. You're pretty much guaranteed to to enter into a psychotic state.
Yeah. Yeah, and I think that it's interesting because sometimes the anxiety and the hypervigilance that can manifest postpartum, a lot of times the mom is repeatedly checking the baby. Is the baby okay? Is the baby breathing? Is the baby okay? Is the baby breathing? I've had moms say, well, the baby's awake. I need to be awake. Or I need to
Mm-hmm.
watch the baby at all times. The baby needs to have eyes on it at all times. And
Mm-hmm.
so they're thinking they're doing this great thing and they're just getting sleep deprived when they really don't. They have windows to sleep and they're not. And it's just getting worse and worse and worse because
Yeah.
anxiety and lack of sleep is like a downward spiral.
Totally, totally. And we know that this is one of the symptoms of postpartum anxiety, is being unable to sleep while the baby is sleeping. Um, I've had moms who literally check up on the baby every 5 minutes during the night and set alarm every 5 minutes in case she falls asleep. So the alarm will wake her up every 5 minutes to check on the baby. Um, and we have to acknowledge that this is coming from a very real fear. uh you know it's easy to see this as, okay, it's an exaggerated fear response. However, we also have to honor that it is coming from a very real fear, and the burden of this responsibility. I'm responsible for this baby. God forbid, if something happens to this baby, I will be devastated. And this fear is really in the driver's seat. So we can have a lot of compassion for moms who operate from this scary kind of place. And and I think this is where I think all this information about SIDS actually doesn't do favors to postpartum moms, because it just, they'll hear about an incident of SIDS here and there, like one or two isolated incidents of SIDS. And it does happen, but it's so rare. And the amount of moms that lose sleep over this fear of SIDS, this is just my opinion, but I think it just does, a disproportionate amount of harm, way more than if they just didn't worry so much about it.
Oh, I totally agree on that. Yeah.
Yeah.
And I've been working in this career for 20 years
Mm-hmm.
and doing home birth and birth center. So I'm not quite as busy as like a hospital midwife. And I have never
Mm-hmm.
had any of the babies I have worked with die from SIDS ever,
Yeah.
but the
Good
amount
to
of
hear.
mom who are worrying about them is incredible. Yeah.
Mm-hmm. Yeah, it just doesn't do anyone favors.
No. So do you want to talk about some of the vulnerability factors and resiliency factors that are going to influence your perinatal mental health?
Yeah, sure. So mental health symptoms, they don't happen in a vacuum. There's always
Mhm.
reasons for them. It's not random, right? Except one mom, two moms can go through a birth experience and one can end up with postpartum, let's say depression or anxiety, and one will not random. So some of the vulnerability factors are, first of all, pre-existing history of mental health symptoms. Somebody who already has is already struggling with depression or anxiety is going to be more likely that's going to be either continue or exacerbate in the postpartum time. It's not going to resolve postpartum.
Mhm.
um, Having a trauma history, a childhood trauma history is another vulnerability factor. Any kind of unresolved or unfinished business, it it shows up again it resurfaces postpartum, kind of unconscious unresolved material can resurface postpartum and also get exacerbated, creating symptoms. um, having a traumatic birth experience is another huge vulnerability factor. And we know that trauma is in the eye of the beholder. Two people can have an emergency C-section, and for one, it can be experienced as non-traumatizing, and she can, she'll be able to continue and go on symptom-free. And for another, it can be experienced as quite traumatizing, and she might end up with some post-traumatic symptoms. And so what's the difference? One of the main factors that determines if something is encoded as a birth trauma or not is how much control does the woman feel in the experience, in the birth experience. um, Moms who feel like something is being, like, they're not really involved, they're not listened to, they just feel like, just like an object. They're like a
Yeah.
body, but not treated like a human being, not explain things. um, that's much more likely to be encoded later on as a birth trauma because there's really no control. Moms
Yeah. And
who
how
are
I've heard,
communicated with and treated like human beings they do better.
yeah, how I've heard this explained is that if they are involved in the decision making
Yeah,
in their
yeah,
birth,
hmm,
and they are treated kindly with respect,
yeah,
that those are really important factors above all of the other details that happen in their birth. Are they
hmm,
involved in those decisions and are they being
hmm,
treated with respect? And I mean, I've seen it
yeah,
even at home birth where there's a home birth, there's no medical complications.
hmm.
And I've had some clients say that they're traumatized, that they wanted more people in the room with them at more times, right?
Oh, yeah,
And then I've had other people say they were traumatized because
mhm,
they felt there were too many people in the room and they wish we would have given them
mhm.
more space. So
Yeah,
that's just like the trauma's in the eye of the beholder. It really, really is.
yeah, it really, really is. These are great examples.
Mhm.
And yeah, and sometimes, especially in a in a hospital setting, it's really sometimes time is of the essence, and there's a lot of stuff that's involved and a lot happening at once. And so when time is of the essence and a mom's or a baby's life is on the line, then involving the mom in decision making and taking the time to explain things and slowing down, there might just not be time for that. So
There usually is.
there usually is.
There
Absolutely.
usually is. And if providers are out there
Absolutely.
listening to me, if it takes 3 minutes, that is 3 minutes well spent in the life of this woman. Forever, she will remember those 3 minutes, whether they were taken or whether they were not.
Yeah, I agree with that. And I think that's really important for providers to hear. I also believe that it's important on the flip side for the patients, for the moms, to hear that sometimes things might not be in their control in the birth room, and that it's okay. It's not okay, but they're strong, and you're strong, and that you have coping skills that you can prepare ahead of time, irrespective of what other people do and irrespective of what else happens that's outside of your control. So I really want moms to have this empowering message. A lot of times, moms do birth planning and a birth plan, and there's this expectation that, okay, my birth is going to go, I'm going to have this kind of setup in the room. These are the people that I want. This is how much communication I want. This is the priority of interventions that I want done. And many times, I mean, maybe you have more experience in the birth room than I do. My understanding is that many times the expectations, the reality does not match the expectations, and the birth plan does not get realized to the T. And preparing that, okay, we can have the birth plan. It can give us this illusion of control, but we have to recognize it for what it is, that it is an illusion for control. And at the end of the day, the only control that we have is just, in our mind and what we tell ourselves, how we cope with the situation.
Definitely. And I think that,
I want moms to be empowered in that way.
The goal of making a birth plan is for the client, the family, to get educated about all the different things that are possible in birth. Because if we've made some ideas and thoughts ahead of time, it's going to be easier for us in the moment. So with my clients, I might have them let's do this nice home birth plan, which is going to involve which pictures do you want, and do you want to help catch the baby? Then let's make a plan for a hospital birth in case we have to transfer. And what are the most important things there? Because you're not going to get it all. We're not at home anymore. And then say we have plan C where we have to go back for a C-section. What would be the most important things for you? And to really get them to realize that we can do our best. We can do everything in our power in pregnancy to eat and exercise and be healthy. But birth is an unpredictable adventure. We don't know the twists and the turns that it's going to take. So your preparation and your planning is great, but yes, you are not probably going to get every single thing on your birth plan.
Yeah, and that's great to set that expectation. And I love that you do like plan A, plan B, and plan C section. It's great for people. I think that's the whole point of a birth plan is, okay, yes, you get educated, you can know about what different possibilities there are, without getting too attached to any of the outcomes. And I love what you're saying about a birth plan, including things that you really can control, like if you have candles in the room, that's a pretty easy thing to control. But things like, I don't want to have an emergency C-section. Well, that's a total toss-up.
Yeah. And I mean, a lot of times we're dealing with first-time moms who've never been to labor. They don't know how they're going to cope with labor. They don't know how they're going to feel in labor, what this particular labor is going to feel to them. How long is it going to be? How many nights are they sleep deprived? So it could be a very straightforward, nice 6-hour birth, or it could be a long 3-day birth. So
That's right.
it's a lot of possibilities.
Yeah, that's right. And
Yeah.
they, you know what? And sometimes they also can change their minds in the moment. The birth plan might say, I want an epidural. And in the moment, they might say, I don't want an epidural, or vice versa. Maybe they do want an epidural, whereas originally they didn't want one. So I think things can change also. And it's important to be open-minded and flexible when it comes to birth planning.
Yeah.
Yeah.
Okay, so we talked about the risk of the traumatic birth could definitely impact their mental health. I've seen that sometimes people might have flashbacks to particular powerful moments in their birth, whether they were very forceful cervical or vaginal exams that they did not want or didn't consent to, or maybe they were saying stop and the provider did not. Sometimes they get flashbacks to that. Yeah, so I think that as providers and witnesses, whether you're a doula or midwife out there, talking to a client during those stressful moments, communicating to the provider, she's saying stop, and providing care and love in those moments to help that person process that a little bit better. And there's all sorts of things you can do after the trauma. I'm a big fan of EMDR. But yeah, definitely the birth process can affect that perinatal mental health a lot.
Yeah, for sure. And we do have a lot of really great trauma treatments, which can be accessed after the fact. But of course, prevention, as they say, an ounce of prevention is worth a pound of cure. So taking those few minutes, which most of the time that is available, to really just show care and respect the client's boundaries, that can really, a little bit can really go a long way.
Yeah. So I know that we both took the PSI course, and they recommend screening for perinatal mental health issues once every trimester. And they also recommend screening again sometime between 3 and 6 weeks postpartum. And I think that's very valuable information because not everybody will come out and look like they're depressed or anxious. But a lot of times we'll be a little bit more honest on the paper, and that you'll find some cases that would have slipped by.
Yeah. I think that, doing the screenings and the EPDS, the Edinburgh is a really great tool for providers to use. It really doesn't take much time, and it really can be surprising what you see on there. In the program that I worked for, we had patients fill out the EPDS had them fill it out on a regular basis. Every week they had to do it. And many times, we think, okay, she's looking like she's doing better. But then on the EPDS, it would say like, oh, really, really high score, like all threes, and anxiety through the roof, and really, more than what meets the eye. And the flip side of it is that sometimes people also underreport and will put down, little to no symptoms, when it's pretty clear from their presentation that they're really, really struggling. So mom is having a hard time, you know, organizing, if she's tearful, if the moods are really up and down, if the way that she's talking reflects a lot of guilt and self-shaming and fears. We know that, okay, if she's not sleeping, we know that, okay, there's definitely concerns here. So if a mom like that has a really low EPDS, something is not matching up here. And this is where the screenings are wonderful, but they also need to be taken in context with talking and to the client, and having that self-report, and also observing, and also sometimes, if it's accessible, also getting collateral information from their family or their support system.
Definitely. Yeah, and there are some people who just don't want it to be on paper. They're
Yeah,
afraid of anything on paper. I usually
I
tell my
hear that.
clients, don't put your name on it. This is just for
Yeah,
us to see a number.
yeah.
Um, and I didn't, taking that class, made me realize that different groups have different scores on EPDS. Like men are depressed at a lower score because a lot of men don't want to admit that they're depressed, and
Yeah,
certain,
underreporting.
yeah, cultural groups or whatever, they may just say, well, life is tough and
Right.
not really recognize it as depression,
Yeah,
so
yeah. And also some of the items on there, they're kind of vague. They're vague enough that they're really open to interpretation. So, uh, so one person can answer, one person can interpret it as, yes, this is affecting me almost every single day. I'm, you know, having a hard time finding joy almost every day, right? But for somebody else, it could be a different interpretation, and they might be like, no, this is not a problem for me at all.
yeah.
So it's
Let's
vague
talk a
enough.
little bit about the intrusive thoughts. I know you
Sure.
brought that up earlier, and I think those are alarming for a lot of people that have not have them. And what I see sometimes is just people thinking about all the different ways their baby could come to harm, you
Yeah,
know,
yeah,
and it's thoughts they don't have any control of. They obviously don't
yep.
want to harm their baby, but they're just coming in like, what if the baby fell down these stairs? You know? What if I
Yeah,
dropped the baby right now and the baby died, or different things? So can you talk a little bit about those intrusive thoughts?
yeah, of course. So a lot of moms have intrusive thoughts. Um, and the intrusive thoughts, I think they need to just be normalized. They're coming from a very normal place of fear and concern. So most moms will have, if they're not lying, will have at least one intrusive thought at some point. I have yet to meet a mom who has had zero intrusive thoughts postpartum. So I just really want to normalize it. And I think the thing that's really the thing that's really distressing is the relationship to these intrusive thoughts. What story are you telling yourself about the intrusive thoughts? A lot of times what happens is the mom will have an intrusive thought like, oh, what if I drop the baby down the stairs and then they fly out the window? Um, and then it and then following that thought is, why am I thinking this? Something must be really wrong with my brain that I'm even having these thoughts. What's wrong with me? I must be a bad mom. I must have a messed up brain. And then like this whole spiral starts. So the problem is really not the thought in and of itself. A thought is just a thought. You are not your thoughts. Your thoughts just come into your mind sometimes. The problem is really the relationship and the story, the narrative around the thought. Um, so the more that these intrusive thoughts can be normalized, and the more that moms can just not get too attached to these thoughts. Okay, so I'm having this thought about the baby falling down the stairs. Okay, cool. It's just a thought. Let's move on. The more that moms can do that, the less the intrusive thoughts are going to have a grasp. We see different variations of intrusive thoughts as well. So, having an intrusive thought here or there might not be such a big deal. But I've worked with some moms who literally this is like taking up most of their mental real estate all day, thinking about all these catastrophes that can happen with the baby. And the intrusive thoughts sometimes can be strong, sometimes they can be quite like uh, have a firm grasp. They can be really hard to move past. It can really just be kind of glued, binded to the brain. So in those situations where, the coping skills, the cognitive coping skills might not be working, we can start with trying to examine and change the relationship with the intrusive thoughts and kind of, try to understand them a little bit better and not be too attached to them, maybe even have some humor about them. Um, but if they're really bothering a person, if they're really happening so much and they're so strong throughout the day, all day, and it's interfering with her functioning, it's interfering with, how she's taking care of the baby, she's overly cautious, she's anxious, she's, walking on pins and needles all day, then then we might want to look at other interventions like pharmacological interventions, which may help with just priming the brain to be more receptive to the coping skills. Um, but in and of themselves, intrusive thoughts, yes, they sound pretty scary, but they're really monsters with no teeth. And I often tell moms that um, the thing that would be if she sees her intrusive thought as something that is, I don't like this intrusive thought. I don't really want it to be there. If she has insight into it, I'm terrified of harming my baby, so I'm going to be extra protective. I'm terrified of my baby being in a catastrophe, so I will be protective. And I'm not okay with having these thoughts. That's actually a good thing. That shows some level of insight. If a mom actually believes the intrusive thoughts, like let's say a mom, has a thought about harming the baby, I don't know, harming the baby in the river or something. If she has this thought and it's like, actually, I think it might be a good idea to act on it, then we're looking at postpartum psychosis, and we have to take it very, very seriously. And, and that's already a really scary thing. But if a mom is like, I'm having this thought, but in reality, I would never follow through on these thoughts, then that shows a level of insight, which is actually very healthy. So those are the moms that I'm not so concerned about.
Yeah, the ones who are showing distress about the intrusive thoughts. Yeah.
Yeah, it's a sign of
And
health.
I'm glad you brought up the topic of medications. I work in the natural birth world. So many people are anti-medication of any type.
Yeah.
That is my big population. And so many times I am brought cases where it has gotten really, really bad. And when I prescribe a medication, I usually do like a month or two of medication. And then I have them come back. And it is miraculous that these medications can work so well for so many people. I loved PSI's pharmacology course, and they really break down the safety of, SSRIs and antidepressants, some anti-anxiety meds during pregnancy, during lactation. It made me feel so much more confident in my prescribing. I think that, there's different levels of depression. And so the proper use of these medications when it's getting really bad, I wish that, people didn't have quite a big as fear of them as they did, because I think they are useful tools in our toolbox. And when people are getting really, down the rabbit hole, it makes a wonderful difference in enabling you to enjoy your postpartum and your baby, where before it's been a really big fight.
Yeah, I'm curious, since I'm not a prescriber, but I'm curious for you, like from a prescriber's perspective, what are some of the biggest barriers that you encounter when people are, not on board with taking medication?
Yeah, so one of the biggest barriers I would say is that a lot of people do not want to prescribe to pregnant people. So like primary care doctors, doctors in the urgent care, the ER, some of them will just like, well, you're pregnant, I'm not touching you. So I run this company called Midwifery, and one of our goals is to help pregnant and lactating people with mental health meds. And sometimes they've struggled for a long time finding someone. So that's the first issue, is actually finding someone who will prescribe. to a pregnant person.
Yeah.
And then I think just a little bit of stigma or some misbelief that it's going to be addictive or it's going to ruin their brain or that people are going to judge them about it. I'm not one of those people that take medications,
Mm.
and medications are tools. Medications are due to science and they are tools, and they can be overused and they can be underused,
Yeah.
and there's a time and a place for medications. And so yeah, I like herbal remedies as well. I know a bunch of those.
Mhm.
They do not have as dramatic of a positive effect as pharmaceuticals do. Yeah.
Yeah. Well, I'm curious, can I ask, how do you help your patients make that decision where, like if somebody is not sure if they need medication or not, how
Hmm.
do you help them make that decision? Because a lot of times, moms can, they therapy can work without medications, they can coast along on coping skills. I think at our PSI training, one of the things that I really starkly remember when they were talking about medications is they said a mom who's having a lot of symptoms has two choices. She can either scale up a vertical wall every day trying to use coping skills, or she can take medications and just walk, start walking on a less steeper slope, start walking on flatter ground and have an
Yeah.
easier time. So I'm curious, how do you determine, like, at what point somebody who's unsure
Mhm.
really needs it, or maybe they don't really need it and they can use other things?
Yeah, so I think with the EPDS, there's scoring, and with the
Hmm.
GAD, if we're at the severe level, we need some medication. You know, Moderate level, medication will probably be helpful, but it's not essential. And then moderately severe, you're getting into that gray water where you probably should be. But the key is, I can't make anybody take medication.
Right.
I have seen some cases where the mom's like, no, I don't want to take this medication. I see how much they're suffering, you
Mhm.
know, and maybe they grin and bear it and get through it and hate their 3 months that they're dealing with this and hate their life and hate their kids and hate their baby, right? Like, just, it's tough.
Yeah.
Um, or maybe a month goes by and they realize I am ready to try what Angie suggested, and they
Hmm.
come back. Things got worse even, you know.
Hmm.
So
Yeah.
it's always, I truly believe in client, decision making. So I'm not
Yeah.
forcing anybody, but it's
Yeah.
always their decision. And I try to really think about what are their symptoms that are the most distressing to them. For a lot of people, it's the sleep. And I know that
Hmm.
if we can get sleep corrected, a lot of those other things are going to slowly get better too.
Yeah.
So I might come up with, I think you should be on these two medications. And then they're
Hmm.
like, oh, no, not two. And so then if they're only going to do one, I try to pick the one that's going to be most helpful, and it's not
Yeah.
like they're going to need to be on these for forever. Most people would say 6 months or a year, you
Yeah.
know, but
Right.
it's an individualized process, you know.
Yeah. Yeah.
Yeah.
It really is. And medication, part of medications is such a loaded topic. Um, so much also depends on the mom's relationship to the medication, and how on board she is with it, how optimistic she is about it. I really strongly believe in the power of the placebo effect as well. It's placebo effect, it's a real thing. And and a lot of times with the moms that I've worked, the ones that are taking medications and say, like, I'm on board with this medication, I really believe that this is going to help me, they start seeing effects pretty quickly. And sometimes they start seeing effects like on an SSRI so quickly that it's even before the medication, fully kicks in. Um, and and I've also seen the flip side where they try different medications, and and they're just not responding so well to any of them, and have doubts. I really don't want to be taking this medication, but I'm only taking it because because I want to please the doctor, or I'm only taking it because I feel like I have no choice, but I really don't want to be on it. So for those situations, just from what I've witnessed, the medications tend to generally work less well, because there's some kind of like unconscious barrier that almost like blocks them from being working as optimally as they can. Um, and I love also what you're saying, Angie, about that these medications are not meant to be a life sentence. They're just meant to be a tool used to, get through some difficult times, and make a postpartum experience more enjoyable and more pleasant. Um, this is one of the misconceptions, is that, well, if I start taking medications, how am I going to get off of them? Is it going to be a life sentence? Am I always going to need them? And hopefully the answer is hopefully not.
Yeah.
But
I
we
think,
know that medications, they work best when they're not in isolation. I look at medications as like, okay, you put oil on a pan, but but then you could add some like ingredients, and then things can really start cooking. But if you just have ingredients with no oil, you need to be stirring all the time to, to like not burn whatever you're making. If you have
yeah.
only oil and no ingredients, then you'll just have some really crispy oil.
Yeah. I like how
It's worth
PSI
testing after.
says that the medication puts the fire out in the
Mhm.
brain, and
Yeah.
that therapy helps rebuild the house and
Mhm.
rewire the
Love
house.
that.
And talk therapy is important, behavioral therapy is important. A lot of people have trauma from earlier on in life that they may have never talked to anybody about, and it's just been there festering.
Mhm.
And now that
Yep.
we've had this big life change and we've become mothers, we realize, wow, look at all those horrible things, my mother did to me, or
Mhm.
whatever. Like, those things start coming up. And so we have to deal with those. And if somebody doesn't want to talk about them, then we need to do EMDR, where we're at least processing them in the body, or
Mhm.
some kind of cranial magnetic healing. There needs to be something done, definitely along with medication. And unfortunately, there's just such stigma about a lot of mental health things that a lot of people don't want to do anything. They're just
Mhm.
they realize they're not doing great,
Mhm. Right.
but they don't want to try it. Some people are like, they don't want to try anything, and those, it's very
Yeah.
frustrating to me when I know that there are some really great tools that can help them.
Yeah, yeah. Well, and this is why it's great that you're doing this podcast and you're putting the information out there, that yes, you are struggling and suffering postpartum, but there are tools, there are methods that can help you. Life can get easier. It does not have to be this hard all the time. So resources are definitely available, should you choose to pursue them.
Yes. So why don't you talk about the postpartum plan that you would recommend for someone that wants to make sure their mental health is taken care of postpartum? What kind of postpartum plan would you do?
For postpartum plan. Yeah, I love making postpartum plans, and I actually do this with all of my pregnant clients, is making a postpartum plan that will equip them with kind of a roadmap of what to expect and what to do, so that they're not, staying up in the middle of the night, um, 3 weeks after the baby, exhausted, and and thinking like, oh my God, I have no idea who to call. I don't know what to do right now. So the postpartum plan is really client centered, and it's really centered on, first of all, the education component, understanding what to expect, baby blues, what symptoms can show up, what can be some of the difficulties. It kind of gets people thinking Um, the second part of it is coping skills. What are the coping skills that can help you to manage postpartum that, they are accessible to you and that you can realistically implement on a regular basis so that you don't have to, you don't have to be in the moment and not knowing what to do. Um, Another part of it is sleep stabilization. This is one of the really central baseline foundational things that is accentuated in the postpartum plan. Like how do we structure your sleep so that you have enough protected sleep? Sleep preservation is really, really, I mean, it's just crucial to mental health. And as they say, that the difference between hope and despair is a good night of sleep. So so that's accentuated. A lot of times parents think that, well, once the baby arrives, I can say goodbye to sleeping. And, that certainly doesn't have to be the case. I also see a lot of times moms who say, well, I need to be up all night with the baby because my partner has to go to work early in the morning and they need their brain to be working. And I'm just like, well, what about you? You're taking care of a baby, like you have a job. Your brain also needs to be working. So, and you're also recovering physically postpartum and hormonally. So yes, your sleep is more important. Um, so that's very much accentuated in the postpartum plan. There are ways to structure sleep to optimize sleep for everybody in the family, not just everybody except for mom. Um, and then the other piece of it is support system. So tapping into your support system. If your support system is small or less than optimal, then building up your support system and either reaching out and finding resources or accepting help from resources that are already available to you. A lot of moms, they find have some guilt and shame about either asking for help or accepting help. But those things are also skills. Accepting help when it's offered is a skill. And so the postpartum plan really hones in on like who are your supports, who are your practical supports, who are your emotional supports, who are your professional supports. Um, and dividing up your support system in these categories so that like who and when you can ask or be receptive to help from. That can also really help people have conversations with their support system about postpartum planning. I encourage moms to share the postpartum plan and even complete it with their partners and with other significant people in their support system, because it really does take a village. So,
Amen to
so
that. Yeah.
yeah, so that's a little bit on the postpartum plan.
Yeah, and I think it's good what you've said. And some of those support people, like people that you can ask for help when you've had a really bad night, I say put them on a list, put their phone numbers there, and put it on your fridge. So that when your brain is sleep deprived and you can't think and you realize you've had a horrible night and you need help, okay, I can go down my list 1, 2, and 3. Can you come over and pace the floor with this baby so I can go take a nap for 2 hours? Is to have those people around you. I think obviously here in America, we do not do a great job of supporting mothers and fathers. We do not have mandatory leave time for parents. So it's beautiful when we can have two parents that are able to stay home for a while with the baby.
Yeah.
That's not always the case. Sometimes a dad might just get 2 weeks or something. But then spacing out the help. The grandparents want to come visit. Well, why don't you plan that for when dad goes back to work? And then plan your sister coming for 2 weeks after that so that you have that help and spacing that out. And that I tell people, and back in the day, we used to live in villages with tons of family all around. And people would be bringing you soup all day and they'd be taking your kids to play with them and you'd have support without asking for it. And nowadays we live these individualized private little lives and we're
Exactly.
lacking that village, and women and men are suffering, with
Yeah.
the new baby.
Yeah, absolutely. And I really think that that's a huge problem, especially in America. I know that here this is a cultural difference. Um, just the amount of support that moms get here is so different than in America. Here, when a family has a new baby, there will be a meal train for them, and you know, and neighbors and friends and community, they will be um they're just there. And that they're just there, and just knowing that even if they're not doing anything that's special, just knowing that, okay, I have neighbors that I can knock on their door if I need something. uh, these little things, they add up and they make a big difference. So
Mhm.
it is a uniquely, maybe in other countries too, but having, having been based in America for a very long time, it really is, I do see it as a unique American problem.
Yeah.
Yeah.
And one thing that sometimes I'll get for families is a little sheet of paper that we can hang on their front door. And ideally, with these meal trains, people are dropping off meals on a front porch in the cooler, and mom and
Mhm,
dad don't have to entertain anybody. And someone is just
mhm.
gifting some food with
Yeah.
no expectations. That's ideal.
Yeah.
Um, Otherwise, there's a sheet on this door that some families put up, and it's saying, "Yes, we have a new baby. Thank you for your love and attention. If we've invited you over, please stay for under 10 minutes or less. And if
Mhm.
we invite you to stay longer, here are 5 chores that we need doing: taking out the trash, putting a load of laundry in, go cleaning a toilet,
Yeah.
taking my older kid to the park for 2 hours," So, like,
Mhm,
very practical help. Lots of people say they wanna help, but they don't know
mhm.
what to do. And everyone loves the
Exactly.
new baby and loves to hold the new baby, but really what that family needs is practical support so that the mother
Yeah.
can hold that baby, can nurse that baby, can rest. And we need
Yes. Yes.
that cultural shift that recognizes it's not about the baby right now, it's also about this mother and this family
Mhm.
that's, trying to survive in this new world of theirs.
Yeah, absolutely. They need the laundry done.
Yeah, they do.
Yeah.
Yeah.
And you know what? I love what you're saying about focusing on the mother, and um, moms need self-care. Just because there's a baby in the picture doesn't mean that self-care has to go out the window. In fact, self-care is even more important. Doesn't have to take, tons of time, but even implementing like little micro self-care into the day, and having some protected time just for you to recharge the batteries, can be a real game changer.
Oh, yeah. Whenever I first notice someone going through some mood changes, I talk to them about what they're doing to restore their
Mhm,
soul weekly. I know that they're taking care of their family, they're taking care of their kids, they're doing all these things, but what are they doing for themselves? For some
mhm,
people, that may be a little walk on the beach. For other people, it's a walk around their neighborhood. For some people, it's sitting in a coffee shop having a coffee with some friends. But
mhm.
figuring out that thing that restores your soul, like you said, it resets your batteries. Like, oh, I had this 30 minutes and now I feel like myself again. You know,
Yeah, yeah. Yeah.
very
And a
important.
lot of times people think that, and speaking of restoring the soul, a lot of times, people think that, okay, I'm just gonna when I want to relax and rest, I'm just gonna like scroll on the phone, or, you know, or binge on Netflix. Um, but the reality is that those things are actually, that they're distraction that just keeps draining the battery more. So when we're talking about, I want to clarify, like when we're talking about self-care, we're talking about truly like soul restorative things, preferably with an internal focus, um, where you can give your body a chance to truly relax and truly repair, uh, and truly repair from all of the stress and the held tension from the day.
Yes. And I think probably the last thing we should talk about is the yoga nidra. Um,
Mhm.
I went to a yoga retreat up north of Gainesville in Florida, and I was meeting a friend there. I was there a little bit earlier, so I'm like, oh, I'm going to go to a yoga class. What's the next one on the schedule? To Yoga Nidra. I'd never heard of that, but okay, I'm willing to try. So I go to this class, and there's, I don't know, 10 people there, and I'm looking around to see what kind of blocks or bolsters, all the different accoutrement that yoga classes have, and everyone's getting really cozy.
Yeah.
And they're getting blankets and they're looking like it's nap time. I'm like, well, this is different, but okay. And that was my introduction to Yoga Nidra. Um, so why don't you explain it from your perspective and now how that can help postpartum?
Yeah, sure. Well, I love that introduction. It's a perfect segue. And um, yoga nidra is a total game changer. Um, for me, I learned about yoga nidra during my yoga teacher training, and before that, I've seen like advertisements and videos for yoga nidra where they just show a person laying down in a shavasana, and I don't know, it just never really struck a chord with me. I was like, okay, they're just laying down doing nothing. I want to work out. So during my yoga teacher training, I really changed my perspective. And I was introduced to the practice of yoga nidra, where your body is sleeping while your mind remains awake, essentially. And it really is the practice of just being there, laying down. You're doing nothing, you're just being. However, while you're being, a lot is actually happening on the inside. So you're laying down very still, and you're practicing what's called pratyahara, removal of the senses. So your eyes are most likely closed if that feels comfortable to you. You're laying on your back, you're not moving. You've blocked out the entire visual world, the entire world of movement. And you can turn the senses inward. The only thing that's keeping you anchored is the facilitator's voice. So the facilitator is guiding you through this very structured, sequenced kind of journey. And the journey goes through the layers of consciousness, and it goes from the external environment to the physical body, to the breath, to the mind, the emotions, the deeper wisdom of the soul. So it really goes very deeply inward. And during this process, the body has the chance to get into alpha and theta brainwave states. And during the last part of yoga nidra, can also get into the delta brainwave state, where that is the deep sleep brainwave state. So a lot of times yoga nidra, you're kind of on this bridge between sleep and wakefulness, kind of drifting in and out of sleep. So you're like semi-awake. You know what's going on, but you're not really consciously awake. You're on that bridge. And in that space between sleep and wakefulness is a space where you can really kind of hover in your awareness and access your true self. A lot of good things can happen from that state. From that state, the body can truly let go and relax. Cells and fibers get repaired and can get repaired. Creativity gets unlocked in the theta brainwave state. So, helps to regulate metabolism and hormones, and pretty much has positive effects on every system in your body. And the cool thing is for postpartum moms, yoga nidra can be such a game changer, because half an hour of yoga nidra is the equivalent of restoration to 2 hours of regular sleep. And so, I don't think yoga nidra should be like a replacement for sleep. However, it's a really great adjunctive practice to optimize the sleep that you're getting, to get more restoration from the sleep that you're getting. And if you do happen to be sleep deprived, then doing yoga nidra can help offset some of the detriments from the sleep deprivation. Um, I I've been practicing ever since I learned about yoga nidra in my teacher training. It really I've been practicing it almost every day, and the practice is really just it, it just uh, it just one of these things where like you just go with it, and it kind of became part of my life purpose to share this practice with more people. I started doing yoga nidras with clients occasionally, and I started practicing it with some of my yoga students, and then I started recording it onto a podcast. I felt like, okay, I'm kind of, I don't want to keep sending MP3s over email to people, to separate people. So I put it on a podcast, and I've just been continuing with that. My podcast is called Nale Yoga, um, Yoga Nidra Journeys for Deep Rest Plus. And it has, and it has a number of these yoga nidra practices, which you can just listen to. Um, the cool thing about it is that it's it's very accessible. It's one click away. It doesn't cost anything, and it doesn't take a great deal of time. You don't have to travel anywhere for this. So it's just a very accessible practice for almost anybody in the world who has access to the internet. um, and it can be really transformational for the mind and body, especially for sleep deprived parents.
Yes.
Yeah.
Yes. Well, I'm excited that you're doing that. I think that everyone could use that. I read a research study. It was in a journal for midwives, and it was talking about when you're doing a late night shift and you're getting tired, just doing like 20 minutes of yoga nidra, like you said, is like having a couple-hour nap. But you're not allowed to sleep on the job, you know?
Mhm.
So you're just meditating in your back room doing the yoga nidra,
Yeah.
and you come out and it's amazing. And I've decided to try that whenever I'm really tired. I've had a long birth, and it is quite remarkable how well you feel at the end of yoga nidra.
Yeah. Yeah.
Yeah.
So do you do yoga nidra when you're like on a regular basis?
I would say, yeah, I do it a couple times a week.
That's
Yeah.
awesome.
Yeah, I'm
Yeah.
usually going off of an app, like Insight Timer that's free, but they have a
Yeah.
lot of different yoga nidra options. And yeah,
Mhm.
I've done it at my house, I've done it at the office, I've done it at a long birth.
Yeah, exactly. You could really do anywhere. You just need a quiet place, and that's it. And it's such an easy, accessible practice. And I actually recommend it to people over meditation, because with meditation, it does require it requires more concentration and alertness. Um, when somebody, I mean, yoga nidra does fall under that, larger umbrella. But when we're talking about like sitting down meditation and concentrating on, you know, on your breathing, or concentrating on, counting, or whatever you're meditating on. A lot of times people will have a really hard time staying still. They'll have a hard time focusing, and their mind is just going to go all over the place, and then they'll start judging themselves and be like, what's wrong with me? Why can't I just concentrate? What's wrong with me? My mind is everywhere. I'm not good at meditating, and it'll cause a lot of people to give up. But with yoga nidra, because you don't actually need to concentrate, you only just need to try to listen to the voice and stay awake. So if your mind goes all over the place, that's totally fine. Uh, because you're in that alpha brainwave state, it it's your mind will be, semi, wandering in places that are important to you. So uh, in that way, yoga nidra is easier than meditation that does require more concentrated concentration.
Yeah. Well, if people are trying to find you or reach out to you, what's the best way for them to find you?
So they can find me on my website, www.mentalfitnesstherapy.org. They can find me on LinkedIn. They can find my page on Facebook, which I created only recently, so it doesn't have much on it right now. They can find the podcast on it's www.naaleyoga, NAALEH yoga.podbean.com. And and if these links are posted in the show notes, you can just click on the links.
Yeah, we'll put these in the show notes. And I want to thank you so much for coming on here today, and thank you for all the work that you're doing for the families that you encounter. I think that this topic of conversation deserves just as much priority and importance that our physical health does.
Yeah.
If our mental health is not well, then it doesn't matter how great our body is. We need both.
Yeah, they work together.
They work together. So if anyone wants to find me, I am at midwifelove.com or midwiferx.com. If you're in need of some medications and no one's wanting to touch you because you're pregnant, I'm here for you. I can assess you and do the quizzes as well. And it's been really great talking to you, Ruthie. For the backstory, Ruthie and I've had to reschedule this. I'm not sure how many times, but it seems like at least 4.
I think this is our fourth attempt.
Life of a midwife, yes. So
Right.
we've just had births on every day that we've been doing them, and one time my internet went out. But I'm really happy we got to meet today, and maybe one day we'll see each other in person at a conference or something. But I want to give blessings to you, and thank you for coming.
Thank you so much, Angie, and thank you so much for all the wonderful work that you're doing, and your bravery in being a prescriber for pregnant women. You're doing just such a huge service, and all the midwifery that you're doing. It's really amazing, coming and helping women, new moms, from this holistic kind of perspective. So I just I appreciate what you're doing. I love that you're doing this podcast, and just so great to be on here and have this conversation with you. And I definitely hope that we can run into each other somewhere in the future, maybe at PSI conference or something. And if you're ever on this side of the world, you can you know where to find me.
Okay, sounds good. Thank you all, beloved community, and I hope you all have a wonderful day.
Thank you so much.